Alright everyone, in this video we are going to go over wound packing. Wound packing is a way to stop serious bleeding caused by penetrating trauma to an extremity that is high enough up on that extremity that we cannot place a tourniquet to stop it. So you can only wound pack the extremities. You can't wound pack the abdomen, the chest, the back, because they're open areas on the inside. So you would just be pushing padding in forever and never able to stop the bleeding. So it has to be from the pelvis down and then from the shoulders down on the arms. So we can't put a tourniquet because it's too high up on the leg, so we need a way to directly stop the bleeding. So I'm going to use this star-shaped wound here as the example of our wound. So we'll say maybe this is a GSW to the leg, and it's too high up on the thigh, so we can't get a tourniquet above it. We need a way to stop the bleeding. So what you're going to do, first of all, if your patient's awake, warn them this is going to hurt, is you are going to reach inside the wound until you can find the place where it is bleeding, and you are actually going to put your finger against the artery or vein that is bleeding. If you need to, you can try and pull blood out of the way so you can see. And you're going to put your finger in there until you are occluding that blood vessel. Now the best thing to use is they do make special gauze that down the middle here, there's a blue stripe, which can be seen on x-ray. That way the hospital can see it on x-ray. After they're done fixing the wound, they can do an x-ray, make sure that they have gotten all of the gauze out. Some of that gauze also has a chemical imbued in it that is designed to help cause clotting. It's called quick clot, and it causes blood to clot to it really quickly and helps slow and stop that bleeding. But those gauzes are very expensive, so I'm not going to open one of them here for the video, so we're just going to use Curl-X. So I've got my finger in here, I've got the bleeding stopped with my finger. So now what you're going to do is you're just going to take this and you're just going to, with your finger, push that in and just directly against where the bleeding is coming from. Finger over finger works the best, and you're just going to keep doing that, being sure that you're packing it directly against where that bleeding is coming from until the wound is completely packed. Now you don't need to make it super tight in here, but we're using this to put direct pressure on that wound. So you just keep packing this in, finger over finger. Notice how I'm pushing over my one finger. That way I'm sure that I'm sliding down that finger and I'm getting this packing right where I need it to go against that internal wound. We're going to keep doing this either until our roll runs out or we filled up the wound cavity. So that's pretty full there. So I'm going to stop. So now we're going to keep our finger on that, and we're going to dress the wound on the external side now. So I'm going to get my 5x9 out, place it over it. Then I would take my next roll of Curl-X and just wrap this just like how we normally would. If possible, it's nice to leave a little tail sticking out. See, I've got my little tail there. That way the hospital knows, hey, this wound is packed, and they can use that in surgery to help follow it in and make sure that they get all of it out. Now my wound is packed. Hopefully my bleeding has stopped because I got that direct pressure on it, and now we can transport rapidly.